I'm Erica DiRuggiero, and this is Healthy Cities in the SDG Era, a podcast about the Sustainable Development Goals and how research conducted by faculty and students at the University of Toronto is helping to achieve them. We're recording from Toronto, or Takaronto, which for thousands of years has been the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. Today, this meeting place is still home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work on this land. In this episode, we'll look into SDG 16, which focuses on promoting peaceful and inclusive societies for sustainable development, providing access to justice for all, and building effective, accountable, and inclusive institutions at all levels. There are several targets for measuring progress on SDG 16. These include developing effective, accountable, and transparent institutions at all levels, ensuring responsive, inclusive, participatory, and representative decision-making at all levels, and promoting and enforcing non-discriminatory laws and policies for sustainable development. Inclusive and accountable institutions do play a role in creating peaceful and safe communities and are essential to sustainable development. Yet, according to the United Nations, conflict, insecurity, weak institutions, and limited access to justice remain threats to sustainable development. A 2020 report from UNHCR, the United Nations Refugee Agency, estimates that about 82.4 million people around the world have been forced to flee their homes due to war, persecution, and conflict. And according to the United Nations, this number is likely higher in 2022 due to increases in violence, demonstrations, and divisions. In this episode, we'll speak with Ross Upshur about the role of institutions in global health. We will also address some of the challenges associated with developing strong institutions and the governance in these institutions, especially in the wake of the COVID-19 pandemic. Then we'll speak to Rushay Naik about his research on the rebuilding of health systems affected by conflict. Specifically, we'll focus on how health systems and service delivery relate to the peace process. Dr. Ross Upshur is currently the Dalla Lana Chair in Clinical Public Health and the head of the Division of Clinical Public Health at the Dalla Lana School of Public Health. He's also the Scientific Director at Bridgepoint Collaboratory for Research and Innovation and Associate Director of the Lunenfeld-Tannenbaum Research Institute at Sinai Health. At the University of Toronto, he's a professor in the Dalla Lana School of Public Health and also the Department of Family and Community Medicine, affiliate member of the Institute for the History and Philosophy of Science and Technology, member of the Center for Environment, and adjunct senior scientist at the Institute for Clinical Evaluative Sciences. He's also a staff physician at Bridgepoint Active Healthcare, Sinai Health, and during the COVID-19 pandemic, he's been actively serving as the co-chair of the WHO Ethics and COVID-19 Working Group and is a member of the WHO ACTA Ethics and Governance Working Group. I'm delighted to welcome my wonderful colleague, Professor Ross Upshur, who's going to speak about SDG 16, which focuses on peaceful and inclusive societies for sustainable development, but also puts an emphasis on how do we provide access to justice for all and build effective, accountable, and inclusive institutions at all levels. And I can't think of a better person to speak to us about the role of global institutions in ensuring equity for all. So Ross, maybe you can tell us a little bit about yourself first and your research.
Oh, thanks, Erica. It's a real pleasure to be here today. So I'm a bit of a mongrel, I guess, in terms of my research and activities, but germane to this discussion. So I'm a professor and division head at the Dalla Lana School of Public Health. And for about 20 years, I've worked with the World Health Organization and other organizations such as Médecins Sans Frontières, mostly around issues in research ethics, but more importantly, ethical issues that arise in epidemics and outbreaks. I have several other hats that I wear that I should mention. I'm also a professor in the Department of Family and Community Medicine, and also the Associate Director of the Lindenfeld Tannenbaum Research Institute at Sinai Health, and a staff physician at Hennick Bridgepoint Hospital. So I do a multitude of different research activities, but relevant to this, I think, is the focus over the past, I'd say, 5 to 10 years, looking at how global institutions interact, particularly in public health emergencies.
Yeah, that's great. I know, given the many hats you wear, it brings a very unique perspective to these very complex issues. So let's start with a rather large question, but I'm sure you have perspectives on this. Why are strong institutions actually needed to effectively govern at the global level? And would love to hear some examples from your experience working with UN organizations such as the WHO.
Yeah, so when you're trying to understand global health and global health governance, it's critically important to know who the players are, which institutions, and it's a real admixture of different sorts of organizations and institutions. So you've got the UN system with all of its affiliated members, and the WHO is in fact a UN organization. You've got a large number of NGOs active. I mentioned already Médecins Sans Frontières. It's a non-governmental organization. Then you've got sort of hybrid organizations like Gavi, which focuses on vaccines, CEPI, which focuses on epidemic response. You've got funders like the Wellcome Trust and the Gates Foundation. Academic or institutions such as universities like the University of Toronto, for example, and then the member states. So remembering that the United Nations is an organization that works in an internationalist framework. That is, it's the member states and sovereign states that constitute that organization. And this is a mixed blessing, and this is why strong institutions are important, because they have to work between the competing and rivalrous interests of member states, which are not always harmonized. And so over the past 2 years, we've seen some interesting innovations, and the WHO's strengths and weaknesses have actually been shown during the COVID-19 response. And a good example of a novel form of bringing together these disparate institutions would be the ACT Accelerator. Now, that's the Access to Coronavirus Tools Accelerator. Most people are aware of the COVAX facility, which has worked with the collection and distribution of vaccines to participating members. But there's 4 pillars to the ACT-A. And so there's a diagnostics and a therapeutics, but germane to our discussion, there's also a health system strengthening pillar. And one of the interesting things is that when this was put together, it was meant to be nimble, it was meant to be responsive to the types of challenges that the pandemic was posing. But they didn't think, I think, enough about governance, about how these organizations will interact. So I've had quite a lot of experience of working between different sectors. Mostly, the most recent one would be not, accepting the COVID-19 experience, would be the Ebola outbreak from 2014 to 2016. And what I recognized then was that there needed to be more attention to how institutions themselves, strong or weak, interact, and what are the rules of engagement. And there's actually a real conspicuous gap in thinking about governance, interorganizational governance. Most people think that the WHO sets the rules, but they have convening power, but they don't necessarily set out the rules. And there's often asymmetries in power and influence between organizations that are brought together to work to solve problems collectively. So just a pitch, we need to think about governance, we need to think about it clearly and carefully, and we need to devote resources to better understanding what optimal and best practice models are. So we can complain all we want about organizations and institutions and the way they function, but if we don't invest resources in how we actually govern these, we will be no better off after this experience with COVID-19.
Well, no arguments from me, having just reviewed this literature for a big report for the public health system in Canada. Certainly, the literature is very conceptual, lots of ideas, but we also need to turn our research attention to assessing the effectiveness of these governance models. Any comments on that?
Yeah, it's heavy on PowerPointology, right? So if I see another slide with all sorts of little bubbles and arrows to boxes, saying that this is how things work, when those bubbles and arrows are actually completely divorced from anything in the world that you and I live in. So I think you're absolutely correct. I would love to see, for example, grand challenges in global health governance. What would that mean? That would mean getting funders interested in seeing this as the important problem that it is, and using that kind of platform to stimulate funding and bringing the best minds in to think through some of these issues.
Yeah, no, I think that's well said. I really find that governance tends to be a black box that we don't actually unpack, and a convenient container for things we can't explain. However, we need to turn our attention to that using a complexity lens.
Yeah, which is ironic, given that if you look at sort of the animating principles of governance, they'll talk about transparency, accountability, trust and trustworthiness, all of which should mean that you have an idea or insight into how the whole process works and who's making decisions on what grounds. But as we've already established, that's far from the truth. So it seems like these principles are kind of window dressing. But you actually don't see the accountability frameworks, the rules of engagement, so to speak. And I think that needs to become much more evident. And I think that's been a criticism of COVAX in particular. Many civil society organizations were brought to the table. They were unclear of their role at that table. They were also unclear as to how decisions were made and how allocations were made. And I think we need to do a much better job. And it's not difficult to envision a much more transparent and accountable system of governance in global health.
Yeah, so we need to move beyond that rhetoric and really look at interrogating these structures and their impact. So given your global experience to date with the COVID-19 pandemic, and I know that rests on big shoulders that you have from past experiences from many other pandemics, what challenges do you think continue to persist despite those past lessons that we haven't learned?
Yeah, there's how much time do we have? I'll try to
Maybe
keep
the
it
top
brief.
5.
So we do need to take normative discourse seriously. So we've been very good technically, but I would say our social and normative intelligence lags behind our capacity to design and develop products and bring them to market. We still have to think through allocation and how we think about resource allocation in a fair manner. We need to think about inclusiveness and what that means and who needs to be represented at tables. I'm very curious to see how the discussions around the pandemic treaty play out, and for global health watchers, keep a very close eye on who's at the table, who's chairing, who's co-chairing, who's represented, and then ask critical questions of whether you think those are the voices, the interests that need to be at the table to move this forward, so that we don't keep repeating the same mistakes over and over again. And a lot of the failings have been, I would say, ethical. And I've written about this before. Most of the challenges we face are about how we actually uphold the uniqueness of each individual life on this planet, when all of the actions and decisions seem to be that some lives matter more than others, because they come from a part of the planet that has established historical patterns of wealth acquisition. Not pointing fingers at any particular countries, but the global disparities are just so marked, and they are within countries, as we've seen here within Canada, but between country inequity is really stark. And if you look, for example, at the vaccine rollout in COVAX, it was really hard for me to sit at tables with colleagues where we're being asked to take a booster for our third dose, where many of my colleagues in low and middle income countries hadn't even been offered a first dose. So that really clear example of inequity is something that I think we need to put mechanisms in to address in the future.
Yeah, no. And so, I mean, many of your reflections have really pointed to ethical principles, and you've already alluded to some of those already. But in a nutshell, what ethical principles actually need to inform our approaches to global health governance, both at the global level, which has its own set of challenges, but also at the national level in a country like ours in Canada?
Yeah, that's a really great question. And, I could point easily to the ones that we've articulated over time as being highly relevant. This goes back to SARS-1 here in Toronto, where we wrote a report that then became a framework for pandemic preparedness ethics that then got taken up by the World Health Organization. And a lot of them were drawing not from principles of ethics for individual level interactions, though those are important. You need to sort of supervene up to what I consider to be the GLUI principles, the ones that speak to the public health nature of and the relationality, particularly of epidemics. So you think about the things that the Director General, Dr. Tedros, has said. If he said solidarity once, he said it 1,000 times at the beginning of the pandemic. And as the inequities of distribution of vaccines, he started to talk about equity and justice. Justice here being a form of redistribution or distributive justice to ensure that all people who are eligible are able to access vaccines. But things like reciprocity, what we owe to each other. And I must say that the latter part of this pandemic response has kind of fractured some of those principles, because people are understandably fed up with public health and public health mandates, and want their freedom. So you start to see these principles of libertarianism rising up when people are, so they've got even within the concept of freedom itself and liberty are two different rivalrous interpretations. So the more that we can appeal to principles or concepts that are other regarding, that are relational, that focus on the fact that, again, to steal from the Director General, we're not safe until everyone's safe. Until we actually deeply internalize that a pandemic requires this of us, that we're going to have to make some sacrifices in order for us to actually get through this. And the justification for those sacrifices rest upon these principles of, solidarity, reciprocity, trust, and enacting on those in order that we can have equity and justice. But early on, when I was interviewed by a reporter, I said, this isn't for quotation. I said, I fear that we lack the resolve that as a society that's going to be required for us to actually get through this particular pandemic. And I think we're starting to see signs of that. You cannot will a virus away. We're in a nice interregnum now as we speak because mask mandates and vaccine passports are being lifted. But I hope that we've learned enough that there's good reason why, if we have to reintroduce this, that we will take it seriously. And I hope we go back and take a really careful look at how proportional and how well implemented many of these measures were put in place, and that they actually serve the goals and the principles that I've articulated well.
Yeah, and on that note, thank you so much for joining us and for really, I think, exposing the importance of ethical principles, which really need to govern the kinds of societies in which we should be living. Reciprocity, solidarity, equity, social justice are among those principles that really need to be enacted, but aren't often realized. So thank you so much, Ross, for your perspective.
My great pleasure. Anytime, Erica. Always at your service.
Oh, thank you, Ross. Rushay Naik is an MSc student in health policy and global health at the University of Toronto. His research centers on health service delivery in conflict-affected states and has conducted fieldwork for research initiatives in Greece, Mongolia, and Switzerland. Rushay has held a research fellowship at the University of Toronto School of Cities at the Center for the Study of the Presidency and the Congress in Washington, D.C., and the University of Oxford's COVID-19 Government Response Tracker. Rushay previously worked for Health Canada's Climate Change and Innovation Bureau and is now an incoming intern to the Health Division at the OECD in Paris. Hello, everyone, and I'm delighted to welcome you to our episode on SDG 16, focused on peace, justice, and strong institutions. And we have Rushay Naik, who is joining us today. Thank you so much, Rushay, for making the time to talk about this topic. I wanted to start off with a sort of an open question. If you could just tell us about yourself and your research.
Sure. Thanks so much, Erica. And it's a pleasure to be on. As you know, I'm a master's student at the University of Toronto, and my research work centers on trying to better understand the rebuilding process of health systems in countries affected by conflict. And that's really sort of one part of much larger work that's happening around the world by colleagues and academics in trying to understand global health governance and improve how we operate in a wide variety of sort of health service delivery contexts. My research sort of tends to center on what we call fragile and conflict-affected situations. The acronym is FCAS. And, that's a term that's used in international development settings to describe states in really challenging situations. These are countries that are actively at war in a civil context or facing other humanitarian crises. And they're often characterized by, fragile and policy and social environments. And so that's sort of where my work tries to fit in. The World Bank will describe these sorts of situations as, involving fractured institutions or consistent crises in maintaining functional government, even things like poor transparency and accountability. And in that mix, we're trying to look at how best to deliver health services, in cooperation with government. And a lot of these issues stem from much deeper systemic challenges that many countries have faced for decades often. And so I really try to unpack a lot of those influences in exploring the delivery of health services.
No, that's really interesting and highly timely. And of course, the subject, I think, merits ongoing attention, really an important nexus between health systems, conflict-ridden regions, and sort of the role of governance and institutions. But part of, what SDG 16 is about is also looking at how institutions and actually health systems contribute to peace processes. So can you maybe tell us a little bit more about what peace processes look like and how health systems and service delivery relate to them, with relevance to conflict-affected regions? And I know you've thought a lot about this and are looking at this in the context of your master's research. So would love to hear your thoughts about that, including, how might that look like at a, country level?
Sure. So it's a great question. And peace is, of course, a very complicated concept. In the popular imagination, we often think of peace starting at the end of fighting, right? It's, what we think of conflict is as ending is the putting down of weapons. And that alone is an act of achieving peace. But there's a big difference between that situation, which is what we term in conflict studies as a negative peace, and between the movement towards seeking justice and the development of inclusive institutions. And that's what we term a positive peace. And I find that health activities involved in peace processes really traverse this transition. There's largely three. There's peacemaking, peacekeeping, and peace building. And those are somewhat laid out in the UN Charter. But they're not always discrete and independent. They often mix with each other, and they often occur in different phases. Very briefly, peacemaking is that initial development of a fundamental trust building through a treaty or some sort of agreement to resolve the conflict. And that's maybe the start of when we engage with some minor humanitarian health activities. But as we move into activities like peace keeping and peace building, that's when we sort of see the achievement of greater security and access for health professionals to enter the space, provide care during issues of health injuries and morbidities caused by conflict, all the way to the much more deeper structural changes to the state and the ways in which it operates to create the infrastructure, social infrastructure, the physical infrastructure for the delivery of healthcare. And that's where I think that interaction is something that peace scholars are really trying to interact with. There is a complicating of this narrative that is now ongoing to add more elements to this triad of peace processes. Conflict prevention is a big one. And it's often seen in the vein of being a regular state-led process alongside with communities and civil society actors and NGOs to try and navigate that. Often countries are navigating their own individual processes towards peace. Sometimes it isn't linear. Sometimes it means that negotiations fail, regional instabilities build, grievances develop, and conflict is spurred again. And so we have to sort of shift away from the notion that that peace will always sort of emerge in the oppositional binary to conflict, and is really this ongoing flow. And health services are one way of understanding how that process is going. We can think of health as this basic trust, and health instruments and institutions as bridging these gaps during the peace process.
Yeah, no, I was just wondering if you had an example, actually, of how peace is considered not in a static but more dynamic and non-linear way, as you've just beautifully explained. Do you have an example of how that sort of plays out in the context of peace through health?
Sure. One of perhaps the most important ones we have right now is the experience of Afghanistan. Just at the global level, we have the concept of the humanitarian development peace nexus, and that's to try and stitch together actors with very different objectives. NGOs from the state, from local community groups, and I think Afghanistan is a really compelling example of that nexus and the work now of international organizations, because we can see how quickly things can change. What I work on in my thesis is what's known as the essential package of health services. It's a tool that the World Health Organization and other bodies use to try and initiate the development of a health system in particularly protracted crises. And Afghanistan's basic package of health services really started to be developed right after the Afghan invasion in the early 2000s, and was a process that continued right up until the fall of the previously international recognized state in last year. And at the time, part of this process of declaring a certain set of health services that the government was going to attempt to finance and govern was really a public statement to try and build confidence in the Ministry of Health, the Ministry of Public Health, and other sort of health practitioners. Part of that was having consultations with local shuras, or community elders and advisors in rural communities across the country. And if we take a step back, that is sort of an attempt to link and bridge the work that's happening at the international level in Geneva, the national rebuilding process happening in Kabul, in the capital, and then, of course, with the intended beneficiaries of some of these newly organized health services. These are, we're talking about communities trying to access primary care, reproductive health care, mental and psychosocial care. So this is really challenging work and not always successful during this period. And of course, as I mentioned, countries have their trajectories, and Afghanistan in this case is navigating a new phase of its story. But I think as we learn more about the interactions between institutions and power dynamics all the way to the community level, I think actors in international development and in global health will get better at engaging communities from that place of solidarity and dialogue. And that's essential for ensuring communities can access their own healthcare.
Yeah, I think those are great points. And given the complexity that you've outlined using, the relationship between what's sort of happening at the country level, like in the example of Afghanistan, but also how that connects to sort of the global architecture of governance, it strikes me that, from a research perspective, it might pose some challenges for how you might approach how you might want to measure the impact of, health systems and delivery in conflict affected regions. So just from your knowledge of the literature and the work you're doing through your thesis, how would you approach metrics and even just coming up with sensitive metrics for evaluating health systems and delivery, and any data gaps or challenges that you've experienced so far in your work? Because metrics are only part of the story, but can you actually measure them is another part of the story. So would love to hear your thoughts on a rather big question, I appreciate, but really thinking about it in the context of conflict sensitive regions.
It is the number one question. Metrics are always a really challenging premise in conflict affected contexts, right? And that's because data is always a challenge. Maybe I'll start with approaches, sort of navigating approaches to evaluation, and then maybe migrate to that space. But when it comes to monitoring and evaluations in health systems discourse, there's often, I think, the assumption that a theory of change is kind of motivating the collection of data and the true, measurement of the performance of those health services. And that assumes a fantastic governing arrangement and an approach where data collection is easy to engage with. In conflict affected situations, that is rarely guaranteed, extremely hard to do, and perhaps even comes at the expense of diverting resources that are already scarce away from actually delivering some care programs that we know are largely evidence-based and have been delivered in other contexts. So, instead, what we can do in this space is two things. One is bringing together data sets, qualitative and quantitative, that can speak to various angles of health in the peace building process. And then the other part is maybe evaluating in a limited setting the performance of programs wherever that's feasible in the context of security circumstances. On that first one, there's no data set that really combines health data and conflict data together, in one go. It's phenomenally challenging. But one common technique in global health and in conflict studies literatures in the political sciences are econometrics, economics, microeconomics based studies that try to explore shocks to economic and social conditions. Things like conflict events are really primed for this. And they're explored to understand how health outcomes shift, amid those events. So often we'll see data sets like the ACLED data set. This is the Armed Conflict Location and Event data set. Extremely comprehensive, almost live data regarding conflict events around the world, as well as the UPSALA conflict data program, or the UCDP PRIO set. And that takes a bit of a longer term view at the state level of conflict events. That can be combined with data from ministries of health, NGOs that are working in different regions to garner local insights about conflict dynamics in health services. And that's sort of on the academic end. On the more practical end, practitioners on the ground, there's a big push for conflict sensitive programming. And that's for international organizations to really work with the principles of humanitarianism in mind, neutrality, effective impartiality in healthcare provision. And so, we see this ranging in things like the Sphere Humanitarian Standards Handbook that is used internationally by humanitarian actors to deliver effective health services. And it ranges all the way to the actual delivery of the service through, one trend is performance-based financing. And that is still being evaluated. The BPHS in Afghanistan was an example where this was used to contract out services. And we're still learning a lot about it, but it's an attempt to try and build in monitoring to the actual delivery of services while it's happening, so that we don't need external evaluations to deal with that process.
No, that's really helpful. And I think you've painted a nice picture of the different data sets and sources that you need to really corral, given the nexus at which you need to be working when you're thinking about health, conflict, governance, health system delivery, et cetera. So I just want to end sort of with a, broader question. So, you're in the process of finishing up your master's, focused very much on this topic. And so just, how can students like yourself or early career practitioners or researchers actually get involved in contributing and advocating for more inclusive institutions in global health, which is certainly a key theme of SDG 16. And of course, thinking perhaps from the perspective of those who are working with conflict-sensitive ideas in mind?
It's a really great question, and of course, the conflict space, at least the academic study of it, is one in which we always want to be mindful of working from a place of equity and ethically as well. Where we're dealing, of course, with and working alongside communities that are facing really difficult challenges in asserting their own interests and maintaining their own health. So I always recommend really delving into some of the existing policy matter, even courses, academic courses that you might be taking in university or in other graduate studies, even some publicly available from websites like a Coursera, I think are really helpful for building a global knowledge of some of these interdisciplinary concepts. I would recommend courses ranging across, the political sciences and international relations, related to the study of conflict and understanding how communities are implicated in them, as well as global health courses that are really helpful for giving us a better sense and providing a fundamental understanding of equity-based thinking in healthcare. And I think the two together ensure that we have the political literacy we need to engage with these very complex situations with a philosophy that is rooted in justice and in the support of marginalized people. I also recommend just getting involved in student groups, some really prominent NGOs that work on human rights as they relate to health. One thought is Amnesty International has groups at the University of Toronto and among several universities. I would recommend engaging with that kind of research and literature that comes out of those institutions to really get a sense of how issues emerge in protracted crises. The last I would say is, if you're ready to go for it, dig into the literature. There's some great reports, even gray literature, that come out of institutions like the Rebuild Consortium, that is chaired by one of the most prominent voices in this space, Dr. Sophie Witter at the Liverpool School of Tropical Medicine. And they have worked for years, to bring practitioners and academics together to better understand the challenges and the ongoing lessons we are continuing to learn about how to deliver these kinds of services in conflict-affected settings. Read the news, stay engaged, stay informed. These are all things you can do to better support your own communities in working in solidarity and in tandem with communities at risk of losing access to care during conflict.
Yeah, I think thanks so much for those tips. And I think your last point around the connections even with diaspora in countries like Canada, who are, deeply affected by what's going on in their home countries, as we're witnessing right now with Ukraine. But this is not uncommon, unfortunately, in many regions of the world, sub-Saharan Africa, Afghanistan, as you've already talked about. And really, this requires multidisciplinary, interdisciplinary thinking and many sectors of society working together. So thank you so much, Rushay, for your excellent perspectives and for joining us today. Really appreciate it.
Thanks so much, Erica.
The conversations with our guests today have really shed light on the importance of the conditions needed to attain peace and justice and develop strong institutions. As Ross explained, it is not enough to just create institutions. We also need to ensure that our institutions develop effective governance mechanisms that model ethical principles like transparency, inclusiveness, and accountability, both within an institution, but also between institutions. This episode has also reconceptualized the idea of the peacemaking process. As Rushay explained, in fragile and conflict-affected situations, peace is not a linear process, but is an ongoing, dynamic process. However, we must also not forget that the peace process at the international or national level must include significant engagement with affected communities in order to develop a truly peaceful and accountable society. Healthy Cities in the SDG Era is made with the support of the School of Cities at the University of Toronto, whose mission is to bring urban-focused researchers, educators, students, practitioners, and the public together to explore and address complex urban challenges. We'd love to hear your thoughts on Healthy Cities in the SDG Era. If you enjoyed this episode, please rate, subscribe, and share to help others find this series. You can find Healthy Cities in the SDG Era on Spotify, Apple Podcasts, and the Dal Atlantic School of Public Health's YouTube page, as well as our Center for Global Health website. Join us for our next episode, where we'll look at SDG 12, Responsible Consumption and Production. Thank you for tuning in, and we look forward to speaking soon. Take care.